Okie dokie. So let's get back to this discussion. We're now at happy hour, kind of the afternoon event that we would love to just share a little bit more about BCAN with you, bring some of our volunteers into the conversation. We're very excited to kind of share these things. I unfortunately am having some technical difficulties with sharing my slides. So Morgan, if you could just go to the next slide, that would be great. I found these little quotes about happy hour. It's the best hour. And you know what we do every day, as I said earlier, really does feed our souls. It really makes us happy to be able to do things that are beneficial to you. And I hope that, I believe that you all got something out of that phenomenal panel of experts in medical oncology and urology and that discussion. And I hope that you concluded that with sort of a feeling of hope that there is a brighter light on the horizon. I think that that's really significant. There's so many exciting things happening right now that there's never a good time for a diagnosis, but we really want to encourage you to think about the fact that things are changing all the time and doctors are learning all the time, in part because people participate in clinical trials. And while we're only connected online right now, we hope next year to see many of you in the greater Baltimore area when we do this program in person. So Morgan, if you could advance my slide. So we'll get to know a little bit more about you, and you get to know more about BCAN and BCAN opportunities. And I just kind of, I was just thinking about how it all adds up, and that we have a really good, strong community that started with Diane and John Qualley that had this brilliant idea at their kitchen table. They brought it into fruition. They talked to their doctor who said, you must do this. And they started an organization that has been growing steadily over 16 years. And I think that underlying concept I just want everyone to keep in mind is you are not alone. So if we could go to the next slide. When I say you're not alone, I mean it. Each year, this year alone, they expect to have, go back one, more than 83,000 people diagnosed this year, and sadly, close to 18,000 will pass away as a result of their diagnosis. And when you think about it, that means that over the last couple of years, there's quite a few people that are living with bladder cancer. We estimate more than 600,000 people just in the United States. So bladder cancer is the sixth most common cancer that nobody talks about. As we brought up earlier, men are 4 times more likely than women to be diagnosed with bladder cancer for many different reasons. And women, when they are diagnosed, are more likely to present for that diagnosis with an advanced diagnosis and have perhaps a worse prognosis because of that. Okay, can you go to the next slide? BCAN is really proud to be part of the World Bladder Cancer Patient Coalition. We were one of the founding members. And I think it's really significant to point out that while we're looking at being the 6th most common cancer in the United States, globally, we're really ranked 11th, which is still close to the top 10 cancers. And they estimate over 600,000 new cases of bladder cancer will be diagnosed this year around the world. So that's a big portion. And one of the things that's going on, and Morgan will share some information after the meeting into the chat box for you, is BCAN was part of the World Bladder Cancer Patient Coalition Patient Experience Survey. We helped to develop the questions, and we would love for our community to fully participate so that we're able to get a good global snapshot of what is going on around the world and how each country might be different in how bladder cancer is being treated, what bladder cancer patients are experiencing. So we encourage you to participate in that survey, and we'll send you the information at the end of today's program. So if you go to the next slide, you're not alone. And as you saw, BCAN brings together some of the best and brightest healthcare providers and researchers. And sometimes they're both the same people. They are clinician researchers. And we bring them to you as patients, as caregivers, as family members, and we all create the greater BCAN family. So let's find out who's here today, who signed up. So go to the next slide, please, Morgan. 78% of the people that signed up for the summit, and there were actually at the end of the day, because I updated this morning, there were 489 people, 498 people that signed up. So 80% of you have a bladder cancer diagnosis, and 12% are family member or friend, 4% are healthcare providers or researchers, and 3.5% are representing the industries that help to support this BCAN Summit. And the rest of us, the 10 of us, are the BCAN staff. And you can see it's really an interesting mix, because about 39% here report that they have high-grade non-muscle invasive. And I know the doctors talked about that. 15% have low-grade non-muscle invasive. And then 24% muscle invasive, advanced disease, 10%. And of those, 3% of you that signed up for today's meeting have upper tract disease, and 9% have carcinoma in situ. So I think it's really helpful to understand that you are not alone, that there are lots of people like you with your diagnosis. So if we can go to the next slide. One of the big things that BCAN likes to do, and I'm going to invite Rebecca to join us, is to raise awareness. It also helps to raise funds for the work that BCAN does. So Rebecca, are you able to put your camera on?
Yep, I'm here. Thanks, Stephanie.
Great.
Yeah, so
tell us about the walk this year.
Thank you. So this is our signature awareness event. Registration is open, as we mentioned, and there's still time to register to get the BCAN baseball cap. We still have some slots in, so you got to get it in quick. Steph, Morgan, can you go to the next slide for me? So we're going to have in-person events in 18 cities this year, as well as continuing with our virtual option. So you can absolutely participate wherever you are. The events are going to be in the spring, so mostly focused in May, but also some in April. And I've asked one of our volunteers and longtime team captains, Karen Sachs, to share a few words about her walk participation. And you should be unmuted. Are you good, yep, Karen?
I'm good. Can you hear me? Okay. Well, I have always been very excited to participate in the walks. It's been an opportunity for me to give back to BCAN, this amazing organization. And, you know, in the last 4 years, I've been walking in memory of my husband, which is near and dear to me. That's his. And it's just a great opportunity to be together with other survivors and not walking alone, as well as a place. Actually, I met women. It was actually my first time meeting women with bladder cancer at the walk. So get out there and walk.
Thank you so much, Karen.
This is awesome, Karen. Yeah, I know it's really significant. I think it's also important to understand that you're a patient and you've been a caregiver, and that is really significant. And we love that you do so much with BCAN and you bring so much to the table. And we, love to have more people participate in a big way. So again, if you would like to, add your name or add your team to the BCAN Walk this year, please feel free to go ahead and do that. So Morgan, if we can go back to the slides, or if anybody has any questions for Karen real quick, drop them into the chat box. How hard is it, Karen, to be a team captain? Oh, we got you on mute again. Can you unmute yourself?
There we go. Okay. One button was working, the other one wasn't.
Okay.
Actually, it's really easy to become a team captain. And one of the things that in the last 2 years or so that has made it really easy is the app, the Walk app. It's, you can invite people to join your team. You can send out emails, you can send texts. And it was honestly really easy peasy. And even for some people, I think that are a little technology challenged, it was really very simple. So that made it super easy for me.
Great. Well, again, we're always looking for good team captains, and bring your friends, bring your family. It's always a fun event, and the virtual event allows you to participate from wherever you are. So Morgan, if we can go to the next slide. Okie dokie. So as I start talking a little bit more about specific things that we do, I'm reminding you that we do try to bring these leading experts across the spectrum of disease right to you at your fingertips on your computer. When we get live again, we'll be able to bring them to you in Baltimore, or our summit, our think tank is going to be in Denver next year. So all of these things are ways that we bring the experts to you. And if there are topics that you think we need to cover, please be sure that you drop them into the chat so we can put them into our plans for 2022 as we go along. So I just wanted to remind you of that. So we go to the next slide. Let's talk a little bit about the treatment talks. This is a new program. If you haven't participated, I highly encourage you to do that. If you're at all interested in clinical trials, please go and sign up on our website for the upcoming trial, clinical trial treatment talk that's going to feature Dr. Peter O'Donnell at the University of Chicago and Dr. Neil Shore, who is on our board of directors, who is a research clinician that's practicing in Myrtle Beach, South Carolina. And they'll be bringing patients onto the conversation because they're doing clinical trials in their practice. And sometimes it's an actual choice to be part of a clinical trial, not so much a last resort. And we'd like people to be more aware of that option. So that is one of the treatment talks coming up. And remember that these are all recorded, and there's a transcript available on our website 24 hours a day, 7 days a week. Okay, next up, I'd like to invite Mark Story. Now, think about that. Mark Story is our Director of Communications. And I'm going to ask Mark to talk to you about why storytelling through podcasts and other things that Beacon does is so important.
Sure. Thank you,
Mark,
Stephanie.
can you turn your video on? There you go.
Yep. Thank you, Stephanie. For those of you who might not be familiar with a podcast, or just to let everybody know, a podcast is kind of a modern day version of a radio show. And in it, our amazing, excellent host, Rick Bangs, has conversations with people and dialogues about topics covering bladder cancer. We have now 13 episodes, with the 14th to be published on Tuesday. But Rick talks with bladder cancer doctors, bladder cancer researchers, and also bladder cancer patients. So, for example, Dr. Plemick, who you all heard from earlier, was on an episode. Carlos Glender, and Carlos, I saw you in there somewhere with Angie. Carlos was also on a podcast kind of giving a patient perspective. And how do you listen? You can visit our website by going to beacon.org/podcasts, or you can go on your favorite podcast app like Apple Podcast or Google Podcast or Spotify, search for Bladder Cancer Matters, subscribe, and then every single time a new episode comes out, you get notified about that episode.
This is great. And we've got a lot in the works. We're planning one right now on environmental risk factors with some experts talking about that and many other topics. And we'll be keeping this going because it's been incredibly successful. And Rick Bangs is the voice of Bladder Cancer Matters. And he is, again, he was working with Diane on that workshop. So it's great to have Rick there because he really does have that lived experience. So if we go to the next slide. patient insight webinars are all going to really continue throughout the year. We have a few coming up: understanding non-muscle invasive disease in October, understanding muscle invasive disease in November, and understanding advanced metastatic disease in December. And remember that all of these are really addressing broader topics in our webinar format. And sometimes they include treatment issues, sometimes diagnostics or prevention, and then sometimes quality of life and survivorship. So we cover a lot of different topics. If there are topics you would like to see, let us know. We'd be happy to try to put things together for that. And I hope that many of you have participated in webinars. They're all now done on our Zoom platform, and it usually works better than it's cooperating with me right this minute. But those transcripts are there whenever you need them. So next slide, please. And Morgan is going to talk in just a second. We actually really wanted to start to reach out to build more communities around the country. And we started last year with some lunch and learn programs where we sponsored programs with hospitals or doctors' offices, and we gave grants to help them supply sandwiches or cookies or something for people to come out to do a program that's really showcasing what's happening in those institutions. And then the pandemic came and we had to change. We had to pivot, obviously, to online. And so we came up with a theme that we thought would work out really well, and it seems to have gone very nicely. And that is coffee and conversations. So Morgan, tell us a little bit about coffee and conversations. How do you plan one? What's covered in those programs? And if you were interested, how would you set one up?
Absolutely. So we love our coffee and conversations. As some of you might have heard earlier, I'm a big fan of coffee as it is. But these programs are regional programs. They're done with local experts in your community. And on that note, the best way to set one up is to talk to your doctor and see if they'd be willing to do this. And then we work with you and the expert, the doctor, the nurse, the social worker, whoever it may be, to set down a time and a date. And then we do this via Zoom. So it's open to everybody in your area. Maybe you have a friend who wants to learn more. This is a really great opportunity for your friend to sit in on that session about bladder cancer. And it's a really great conversation about what's going on in the area, what maybe is happening inside of the clinic, what the average patient experience is. You get to be, quote unquote, in the room with other bladder cancer patients in your area, which is really, really great. And we do send coffee mugs out to every participant. We couldn't buy you lunch, but we can send you a coffee mug. And the best way to set one of these up is to email me, preferably talk to your doctor first to see if they're willing to do it. Or if you know that you can talk them into anything, just go ahead and email me at mstout@bcan.org and say, hey, I'd like to set up a coffee and conversations. You just heard from Karen, and we're actually working with Karen to have a series here in Northern Virginia next month. So we're really looking forward to that. And we have one coming up in Colorado as well. So these are very specialized programs, and we're very much looking forward to what the future brings us with them.
Yeah, it's a great way to build a sense of community until we can get back together again, and we'll hopefully reinstate our lunch and learn programs and be able to travel out to meet you all in person. So great. So switching gears a little bit, let's talk a little bit about our Survivor to Survivor program and how we help to support the patient community. You know, we've got probably close to 70 people who have gone through our training to really think about how they could talk to other patients. I know some people also do programs where they can coordinate with patients in their healthcare practice, but this is something that runs through BCAN. It's an opportunity for a trained phone call where we invite people to submit their information and we try to match you. So Bernadette is responsible for being the matchmaker in all of this. Can you turn your video back on, Bernadette? Are you here?
It is on. It's on my screen. Can you see it? Yeah.
Okay, good.
So
okay, great.
A warm
How do
welcome
we
to all
match
of you
these
who are
folks up?
a warm welcome to all of you who are part of the S2S program. It's been great working with all of you. One of my favorite things is getting a positive email back after you've spoken to a survivor and shared your bladder cancer journey. It's just so wonderful to have all of you, and we'd like you all to share some of your experiences. And I know that Don Barber specifically said that he'd like to share his experience and the positive aspects of volunteering for Beacon's Survivor to Survivor program, and what's the best part about reaching out and having this opportunity to share your
Don?
experience with others. So, and Alyssa De La Roche will also, I think, be speaking up. So I believe Stephanie will be introducing them. So thank you both for offering your time to tell us a little bit more about your experience.
So Don, if you could turn your audio and your sound on.
Okay.
Audio and your video on.
Okay, I think.
I'm only seeing a strip of people, so I don't know if your video is on.
Okay, my video should be on. I'm seeing
There
myself.
you go. I see you now.
And you can hear me too?
Yes.
Okay,
Perfect.
that's great. Excellent. Really good to be here.
Good. Well, wait, thank you so much for all you do. So tell me, what do you get out of being a Survivor to Survivor volunteer?
Well, it's huge. And that is, I'm retired, and I used to be a school psychologist and work with a lot of people, helping kids, helping families. And this being a volunteer really helps me to get a sense of purpose and meaning and make my journey count for something, and be able to share with other people my little tricks that I've learned in the past year since my cystectomy, and dealing with this and being able to live a full life. So it's been a great journey for me to be able to reach out to people.
Great. Thank you so much. And I think, again, we're always grateful that you share. Remember that Bernadette is going to match callers who want to talk to somebody based on the diagnosis and the treatment that you're facing, so that you're getting the right input from the right people. Another one of our longer time volunteers is Alyssa De La Roche. Alyssa, thank you for coming and joining us for this. So tell us, what do you get out of being a Beacon Survivor to Survivor volunteer?
Yeah, well, when I was first diagnosed, I had never even thought I heard of bladder cancer. I was, just like, what did you? And I turned to many people, but it took a long time to find someone to talk to, and there you are, Neil. Luckily, at Sloan Kettering, we had a support group, and I met, Neil and many wonderful people who helped me in the journey the week before I had my surgery. But before that, I was clueless, and I found BCAN, and I was like, wow, this is fantastic. But until you find it, you're really alone. And I thought, wow, if we have the Survivor to Survivor, and at Sloan Kettering, we have the Patient to Patient program, which I also am a member of. And I thought I volunteer with, but I thought, wow, it's so wonderful if someone can access a person who's gone through it and talk to them. And when people tell me they're really thrilled, it's like an angel from heaven, they call me, and it's not that I even do that much, but really listening and being there and answering questions that they might have. And most of it's so much anxiety too. We have so much anxiety of not knowing. So it's really helpful to have someone who's been through it and can say to you, yes, I'm here on the other side, and there is life after cystectomy and all the other things.
And really that goes back to that first slide I did earlier in the day, where you're embarking on a scary journey in a dark forest. You have no idea what to expect. And it is nice for somebody to say, yep, it's okay. You can make it down to the end of the road. I've been there. I'll try to tell you where the booby traps are, where the goblins are hiding behind the trees. And it really does make a big difference to be able to get that live input from people. So thank you both so much. Anything else you want to add?
Yes, I was going to say the other thing is that, physicians and other people in the staff, they'll say, well, this is what I found, this is what I found. But when someone actually has had the experience, and it's not going to be the same for everybody, but has actually had that similar things going on, it does feel different. And it's really helpful to a patient to hear that from another patient.
Yeah.
Yeah, so many people I've talked to so far, they're really scared about the whole thing, the unknown, the pain, the recovery, what's it like? So I got a lot of questions about that, and I was really glad to be able to answer based on what I experienced. And I'm really lucky in that I've had virtually no complications, and I've been able to live a very, very full life. And most of the time, I don't even know that this collection bag is even there anymore, which is great.
And remember that we do have volunteers across the spectrum of disease, from non-muscle invasive all the way through. So again, we do try to match you by age, by gender, as much as we can find out about you. We even try to match sometimes by things you like to do, because if you're an active person and you want to know about living actively when you've had bladder cancer, that helps to talk to somebody that's also an active person. So thank you both. We really appreciate it. Got a few more things to talk about. So I really appreciate it. Morgan, if we can come back, and we're going to talk next about chapters. So Morgan, you work directly with our chapters. Now, people are saying, well, how many chapters do you have? We really don't have a lot, because it does require a little heavy lifting from some volunteers. We're based out of the Bethesda area, right outside of Washington, D.C., but yet we're a national organization. And to really have a good chapter, you really need to have boots on the ground. And so we really rely heavily on volunteers. So can you talk a little bit about the chapters, Morgan, and how do you help them from the staff side? And I think somebody's here from one of our chapters, if you want to invite them to speak.
Absolutely. I'm going to stop sharing my screen. That way David and I can jump on screen. David Langham is here from the North Carolina chapter. And so what happens with a chapter is it's a regional group that is more focused in that area, and they help bring awareness and raise funds in their community. They can give back to their community. And what it takes is, when you're starting a new chapter, it requires at least 3 invested in individuals. And it's always helpful if you have more. And what really happens after you've already started, you've said, okay, I have my 3 people. You do at least a walk every year, and you do another fundraiser. And we have some policies in place, and we want to make sure that we are supporting you as much as you help raise awareness for BCAN. And part of the other things that you would do in a chapter is you can get together with fellow BCANites, if you will as go to health fairs or street fairs. And I would love to invite David to talk a little bit about what he does in the North Carolina chapter and what the North Carolina chapter does.
Sure. Can you hear me?
Absolutely,
we
can.
can.
Okay, great. Thanks for giving me the chance to talk about the chapters. I'm really excited about it. I did make a few notes because I need notes. So we do have 2 events a year. We do the walk, and then we have a golf tournament, and that raises quite a bit of money. Our group consists of 5 to 6 people. We have 2 survivors, a caregiver, 2 nurses, and 1 woman who just wanted to get involved in this thing. And we are all very, very active with the chapter. We meet once a month, and we take the summers off. And we've raised quite a bit of money. And so what I wanted to do, if it's okay, is just to kind of explain how we use that money locally, because I think that while BCAN does its stuff nationally, we want to be a good voice for BCAN locally and support bladder cancer people locally. So here are some of the things we do. We have paid for we pay for rooms for family members to stay at the Family House, which is a local hospital-oriented place for them to stay. If they're bladder cancer patients, their families can stay there for free. We have an emergency fund for people who can't afford, say they've got to have some kind of a scan or something and they can't afford it. We have some emergency funds that we use for that. The first time you go for a BCG at UNC Hospital, you get a gas card, $25. Helps you pay a little bit off. The chapter funds the Triangle Bladder Cancer Support Group. The domain name, pay for the domain name, also pay for the Zoom bill because we're on Zoom now instead of meeting in person. We take lunch and treats to UNC Urology since COVID has started. Not, every once in a while. We do a lot of street fairs and go into, well, not so much since COVID, but we do a lot of the health fairs that are in the area because the Triangle area of North Carolina has a lot of health fairs and that sort of thing. And we keep track of the counties. I wish I was at home. I could show you the map, but we have a map on our, I think it's on our Facebook page, but it's a list, it shows a map of North Carolina and it has in orange all the different counties that we have, that our monies has gone to. And you can see that it's a pretty impressive map. We've touched a lot of people through our local chapter. That's some of the stuff. We give some money to the bladder cancer picnic that they hold up in the mountains. I think that's all I can think of. But it
I actually have one more thing to add to the things that you do. This last year, you did a pilot program based on the funds you raised that helped cover the gaps in folks that are maybe uninsured or they have insurance that they just signed up for, but they still need tests in the interim. And it was a really, really cool pilot program. Yeah,
that's been really successful. And it's really helped a lot of people that couldn't afford things. So. Yeah, we stay pretty busy and we're all very committed to making this happen and making it work locally. So, yeah, we're busy folks.
You are busy
and
folks.
We thank you so much. This has been great. So again, it does take a heavy lift from a team of people that are really dedicated to do it. It's not something that you can just start a chapter and then decide you don't want to do it anymore. You really do make a commitment. But when you're somebody like David and his team, they have a great chapter. They're very active. They do some very serious fundraising and are able to do a lot with the chapters. Others just participate in a walk. There's lots of different ways to do it. And if you're interested, again, this is how you reach out to the existing chapters in Northern New England. There's a chapter in Richmond and San Diego, North Carolina chapter, or Albany, New York. So there are options.
Absolutely. And every chapter is a little different, and what works in your community may not work in other communities, but we're happy to help support you and get you in touch with these local chapters if you're in the area, or start a chapter if you would like.
Mm-hmm. Yeah. So now if we can move on to the next slide and talk about stories. And again, Mark's story, I'm going to invite you to pop on here. So are you here, Mark?
Yes, I'm here.
There we go.
With my camera on.
I just didn't hear. Excellent, excellent. So talk a little bit about the process for sharing your stories and what are we going to be doing with stories over the next year?
Sure. Well, first, I want to mention the person who does really all the heavy lifting for the bladder cancer stories that we take, and that's our colleague Jocelyn Brown. She has taken that over, and what she does is when someone fills out a form on our website indicating willingness to tell their story, she sets up an interview. She gets the opportunity to speak with the person and then take the story and put it on our website. And you see a little sampling of the stories here, but year after year, one of the most popular sections on our website is the stories section. And I think that I kind of approach it from a dual perspective, because I think there's benefits to sharing your story, and I think there's benefits for the people who absorb and read the stories too. If any of you out there are considering sharing your bladder cancer story with the community, much as Don and Alyssa were saying, many people have a desire to give back. And sharing your story is a way to give back to the community and make some connection with others. I've been following the chat here, and somebody said in a recent comment that they felt as if they were alone. And now that they're meeting so many people virtually, it helps reduce that a little bit. And I think sharing your story can also help promote connection with others. And the connection with others doesn't necessarily mean that you'll meet the person whom you connected with, but you might get a chance to brighten their day a little bit or lighten their load. And what readers have told us about reading the stories from other bladder cancer patients and caregivers is that many times it offers a sense of encouragement, where they see somebody went through something very difficult, maybe a radical cystectomy, and seeing how people coped with that. People have told us that it makes them feel a little bit more encouraged. It can help increase understanding if you're reading something, much like the Survivor to Survivor program, from the perspective of somebody who has undergone a particular treatment. But most of all, I think it really helps strengthen the sense of community that I'm seeing via the Zoom screen today, and all these wonderful people and heroic patients and caregivers who give their time to give to others via the stories section on our website. So if you would like to share your story, please visit the URL that's on the screen there, because we'd be absolutely delighted to work with you.
Great. This is awesome. And again, if you're interested, we commonly get requests from our pharma partners or from other groups like the cancer support community, where they really want to understand what is bladder cancer really like, because they're out there supporting cancer patients, and bladder cancer patients don't always have the same experience as, say, breast or prostate or lung cancer patients. It's very different. Every patient is unique, but you can speak and share your experience. It helps others to really understand what's happening from the BCAN perspective, from being part of the BCAN community. So thank you, Mark. So let's jump ahead. You know, one of the things we're adding for 22 is really going to be doing more video patient stories. We did a few of them this year. We were able to get some funding to really produce some professional videos of patients sharing their stories. They're all on our website, and we'll look for more of those coming up in the next couple of months, because we'll be doing more as we move into 2022. So let's talk about advocacy. It's in our name. It's what we do. I think it's also really important. Somebody needs to speak up as an organization for the bladder cancer community and what our needs are. And that picture on the right is showing you one of our longtime patient advocates, Jim Scott, who was there with his representative on Capitol Hill. And we work to bring issues that are pertinent to our community to the awareness of the folks at the federal level in Washington, D.C., and as I said earlier, on the state level as necessary. And we are updating our legislative priorities, but we do have them on our website now, and we're making sure that we're in sync with the issues that are coming in front of our representatives now and what those committees will be voting on that is going to impact the bladder cancer patients. We are working to develop, if the pandemic allows us to come to Washington again and bring people, a possible Hill Day where we're going to invite you to come in and represent the constituents in your state that have bladder cancer and speak to the people that are legislating the decisions that are going to either make your treatments easier or more affordable or more accessible, and funding research to making all of this move down the pike even faster so that we can make more advances in bladder cancer. We do provide training and we do provide tools. So if you are interested, send me an email at chisholm@bcan.org, and we'll also be sending stuff out, but we'll have ways that you can participate from the safety and comfort of your own home. You can send emails, you can do phone calls, lots of things, and we'll give you all that you need to be able to be informed in your discussions with your legislators. Okie doke. Next slide, please. So one of the groups that we love to work with, and they tend to be the ones we invite to our think tank, our scientific meeting, are our Beacon Research Advocates. We started, as I told you earlier, with the Patient Survey Network. And then we really encourage people to really express and understand more about the spectrum of disease, maybe more than just your diagnosis, and really be able to represent the Beacon community in advisory boards for drug companies and also in advisory boards to develop research. You all had the opportunity to do that during our workshops earlier. Some of our patient advocates, and I think I saw Jonathan on here, Jonathan Paschal, if you're on and you would like to turn your video on, have been grant reviewers for large grants like the CDMRP, the Congressionally Mandated Department of Defense research program that helps to support cancer research. So Jonathan, if you're here and you'd like to turn your video on, just let us know, and I'd love to hear your take on how you have been doing so much for us going on the Hill, but also helping with the research. You there? He might have jumped off. I'm sorry, can't see it at this point. But Rebecca, we think patient voice in research is really significant and important. So Rebecca Borowski, our new research director, could you jump on?
I'm here.
Oh, great. Excellent. So tell us a little bit about why that patient perspective is important. And, you know, Beacon has invited some of our research advocates to actually review our grants.
Yeah, absolutely. It's so important to involve patient advocates and stakeholders in the design as well as the evaluation of research. And that's to make sure that we're funding and advancing research that will have outcomes that are meaningful, important, and useful to patients. And we heard Dr. Taylor talk about patient-centered research a little bit earlier. And one of the ways Beacon is advancing this is specifically through our patient-centered clinical research young investigator award, where we do invite patient advocates to actually help us evaluate the proposals and participate in those reviews. And that will also be a component of our newest grant offering that we'll share more information about soon, the Career Development Award as well. And in this role, we ask patient advocates to really assess how well the proposal addresses a patient-centered research question and evidence gap, if it's a specific health decision that the patient is faced with in the course of their treatment or care, and also how well the results of that research might improve outcomes that patients care about. So not just survival or recurrence, but other outcomes like physical functioning, pain, side effects, quality of life. And lastly, we ask our patient advocate reviewers to assess the involvement of patients and other stakeholders in the design of that research. So how well did the applicant do in engaging the appropriate community and patients in putting together their research ideas? And we think that this is just critical to making sure that we're funding the right research questions that will give us the most useful outcomes.
Thank you so much. So again, if you're interested in being part of the Beacon Research Advocate, we would love to have more people involved with that, because I think it's really critical. And you know, the research may go on with or without us, but why not have our voice in there? I think that really makes a huge difference, and it's just a great opportunity for you to give back in a bigger way if you're interested in doing that. But again, Beacon does have that award, the Young Investigator Award, on patient-centered clinical outcomes research. And it really is looking at how do we improve the lives of patients with this disease. And that's really significant. Thank you so much, Rebecca. This is great. And then if you want to go to the next slide, Morgan. Okay, let's talk about health equity in bladder cancer. And health equity is really addressing all aspects of disparities. And we are actually in the process now, as we move into 2022, doing a lot of our planning. We have always addressed issues of diversity, equity, and inclusion in our programs and services. But it's always sort of been just a thread that perhaps never really was the main focus. And we want to be able to make this more of our main focus in the sense that attention is really being paid right now to inclusion and diversity. And we want to be able to make sure that we're meeting the needs of all of our populations, whether it's geographic, socioeconomic, race, it doesn't matter. These are all things we want to be inclusive, and we want to be representing you. If you are interested, if this is a thing that strikes you and you really feel like you'd like to be part of that, please send me an email. We will be convening a task force, and we will be meeting a couple of times a year to really look at Beacon's programming and how we can really help put that spotlight of health equity into our equation. I think you're seeing that we're doing an awful lot, but how do we do better? And I think this is important. So Morgan, if you could go to the next slide. And I guess we can just go back to general. You can stop sharing, but if you have any questions, you can ask questions. Anybody have any questions? If you have a question, do the raise your hand thing and we can get you to speak. No? Well, I see that there's been a lot of great suggestions. I look forward to reading all of the chats so that we can look at the topics that you want. And in some cases, we probably already have some of the topics that I've seen come through on the chat, and I'll make sure that you know where we have that resource, because we have quite a few things on our website. So Andrea, if you could turn your video back on, kind of wrap up this day. We'll probably end a couple minutes early. But where's Andrea? I don't see her.
I'm
on
here.
The video now.
I'm here.
There you are. Okay.
Can you see? Oh, okay. Can you see me? Well, I think it's been a lovely day. I think people have gotten a great deal from it, you know, especially, you know, the doctor's portion when they were talking about the many different options out there and, you know, having to figure out what's the best option to use. I believe that we're in a much better spot than we were even 5.5 years ago when I got here, and there was really nothing out there yet. And then things start popping up. So I think things are looking better, but we still have an awful long way to go. And that's why the Beacon staff is here to continue to support this Beacon community. And I'm excited about what's going to happen for next year.
Diane, I'll invite you if you have any closing remarks. I hope this has been a good meeting for you. I hope you got a lot out of your workshop.
Well, the workshop was great. I think this was a wonderful meeting, and just seeing everybody's comments. I think this does what we set out to do in terms of provide essential information and access to resources to everyone in our community and connect people. So as we said, nobody ever feels alone. And it's a wonderful community, a wonderful family. I thank the doctors who were amazing and always give us a reason for hope. So it's just wonderful. And again, thanks everyone for joining us. And thanks so much to the fantastic staff for putting on such an amazing meeting.
Yeah, great.
Thank you both for starting us off, and really thank you everyone for joining us. I hope that you got something out of it. I hope you don't feel alone. I do want to remind you that at 6 o'clock tonight, you should be getting an email with the link to the evaluation. I'd love for you to do it right when it's fresh in your mind, because your opinions and thoughts really are important to me. And I do appreciate that. And Morgan also is dropping in the information about that global survey that I mentioned earlier. I didn't want you to jump off to do that while you were paying attention here. So We'll get that to you. And if there's any last comments from anybody in the group, we just appreciate your hanging out for, this is a long day, 5 hours. Any last comments?
Thank you. It was a wonderful meeting.